Hello everyone, welcome to another video where I talk about the medical sector and some aspects regarding to it. So today we're going to speak about technological and digital developments in the medical sector. So in the past 100 to 150 years, there have been many technological and digital advancements in the healthcare sector that has helped revolutionize the sector. For example, in 1865, a digital technology was invented by a German doctor that changed the means of diagnostics and made it a lot easier. I'm talking about the invention of X-ray technology. But some of the more recent advancements are vaccines, telemedicine, gene engineering, and AI. These advancements of technology has helped make multiple things easier in the field of healthcare. Technologies like electronic health records or EHRs have made lives a lot easier. By keeping medical record and history electronically, it has helped track the patient's medical state over time on computers rather than doing it on paper, which have been much harder. So these technologies have been helpful in the most critical global crisis in the past 5 years. I'm talking about COVID-19. A technology called telemedicine was founded in the 20th century. This technology allows access to various forms of medical consultations, psychotherapy, and physical therapy through wireless technologies like laptops, smartphones, and tablets. It was very helpful during the COVID-19 pandemic, as visiting doctors physically was very risky for patients that needed constant checkups or consultations from the doctor. But apart from making things easier, some latest technologies have helped save lives. Even genetic editing is one of the latest technologies that deals with repairing a damaged or mutated DNA structure to remove life-threatening genetic disorders and diseases within people and stop carrying these genes to future generations. But to carry out all these processes, AI, which is another latest technology, has been very helpful in the sector to analyze and organize large scales of data and observations. Basically, there have been significant technological and digital developments in the medical sector all over the world, as in both economically developed countries and less economically developed countries. In this video, I will be talking about these major technological and digital developments in healthcare, comparing their use and challenges in the MEDCs and LEDCs. These differences are reflected through various aspects of healthcare systems provided by the government and regarding use of latest technologies in the sector. To understand these differences, I'm going to use some examples of technological advancements mentioned earlier. So the first example is telemedicine and telehealth. As mentioned earlier, this is a technology that promises facilities of healthcare digitally through platforms like video calls and online communication. Over time, this technology has become an important technology serving as a lifesaver for people living in remote and underprivileged areas with less medical facilities nearby, in both MEDCs and LEDCs. While in MEDCs like the USA or the Scandinavian countries, it is used for routine consultations, follow-ups, and mental therapy. Like during COVID-19 pandemic, when it had become a critical part of safe healthcare services. In the LEDCs, on one hand, it has helped provide professional medical help in geographically disadvantaged locations, having a shortage of professional healthcare facilities. But on the other hand, the implementation of these often face struggles with availability of internet, digital education and tools, and lack of required infrastructure. Even though there are some organizations in rural areas in Africa, for example, that try to help people access telemedicine, despite the barriers, these challenges do exist. Another technology that has been one of the most used and important innovations is the EHRs, or electronic health records. Countries like the United States and the United Kingdoms have made a lot of efforts to successfully implement EHRs with supporting policies and infrastructure. In these MEDCs, this technology has been hugely adopted and a vital part of most healthcare systems and organizations. EHRs help improve accuracy and efficiency of patients' information management. This helps ensure better care and medical help to those who need it. In LDCs, the use of this technology is much less common due to limited infrastructure, low funding, and lack of professional help. Many LDCs like Afghanistan and African countries still use paper-based records. That is very inconvenient and inefficient compared to developed technologies used all over the world. Fortunately, in some countries like India and Ethiopia are slowly improving by using more digital-based health tools like EHRs and HIRs. Now, these are some very specific examples of technologies that have been implemented differently in MEDCs and LEDCs. But do you know the reason for this difference? How are people in these countries living when they don't have efficient healthcare systems? It is true that before these technologies were invented, there were some good healthcare systems, but as technology evolved, the MEDCs were fast to adopt it, unlike most LEDCs. This is due to some aspects of the two categories that are different. Now, there are many such aspects and elements, but I will be talking about some of the most important ones. First, we have is infrastructure. So the graph you can see shows physician density number in countries. This means it shows how many doctors the countries has per 10,000 people. As you can see, the countries with less physician density are mostly LDCs. This is because most people in these countries live in rural areas where it is difficult for the government to provide medical infrastructure and facilities that are available to everyone. Whereas, most MEDCs have strong healthcare infrastructure with more physician density. Along with that, as mentioned above, there is very little digital literacy within people of all backgrounds, which means that there is not a lot of exposure to technologies like EHR and telemedicine in LDCs. Second is economic resources. Like said in the name, MEDCs can clearly provide more funding for healthcare services, technology and infrastructure than LEDCs can. For example, USA, which is MEDC, spends about 17.3% of their GDP every year on healthcare services. Thus, as USA's GDP is about $27.6 trillion, the amount spent on healthcare would be around $5 trillion. Whereas in Afghanistan, which is LEDC, 21.8% of their GDP is spent on healthcare. The GDP being about $14.5 billion, the total amount spent on healthcare is only about $3.05 billion. Also, in MEDCs, the government policies often encourage adoption of digital and newly developed efficient technologies with generous funding and strong infrastructure, unlike LEDCs, where they don't prioritize digital and technological advancements in healthcare because of lesser economic resources. In conclusion, while there are growing technological and digital developments in the healthcare sector being used in both MEDCs and LEDCs, the extent of their implementation and availability varies significantly. I encourage you all to work towards being medical professionals that try to decrease these differences in the future. There are some organizations from MEDCs like the USA and many LEDCs that work towards trying to provide the citizens with good medical care and digital education. So, with help from these and from all your bright students studying to work in the field in future, we will make change happen so everyone has access to the best healthcare services. Thank you.